Aloha, this is Audra from at Vancouver Massage, and I wanted to give a big thank you to all of you folks who are out there still working in the essential systems, be it healthcare, grocery, feeding people, making sure that the homeless, the children who aren't able to have school lunches, everyone is being fed, cared for, our elderly are being cared for. You are my heroes right now. I used to work in hospitals, so I totally understand. Many of you, especially those working in the retail environments, you're doing a lot of repetitive motion, a lot of movements, pulling, pushing, lifting with weight. You may be overhead, and you're starting to feel some pain in the elbow, forearm, maybe in the wrist a little bit. These can be the beginnings of or actual symptoms of what's called tendonitis, golfer's elbow and tennis elbow. Golfer's elbow would be medial tendonitis, medial epicondylitis, if you want the fancy word, and lateral epicondylitis. Now, the ligament right here in the elbow that you feel the pain in is actually the attachment point for all of the forearm muscles that come down and become the fingers. Now, from about here to about here is actual muscle meat. These are connective tissue. You're going to feel pain at the connective tissue because the muscle is tightening up and actually pulling away from it. And that's what causes inflammation and pain. Now, the repetitive movement, especially when weight bearing, as you can see, massage therapy, I've got Popeye arms going on. If your forearms are really sore, your arms are stiff, your wrists hurt, this is some simple self-care things that you can do that I do on a regular basis. Now, you can use just fancy lotion. I like just good old plain old olive oil. Don't need a whole lot, see? Just a little bit, okay? We're not trying to baste our arm. We just want to provide a little bit of slide. Now, the furrier your arms are, if you have more arm hair, you'll want to use a little more oil, or you may prefer to use a lotion. Lotion tends to be slicker, but we don't want to grease it up like a pig. You just want to have a little bit of glide, okay? Now, first thing we're going to do is we're going to stretch. Stop. You got a little bit of pull. Provide slightly more of a stretch. That's going to be stretching your forearm flexors. Then we have, hey sailor. This stretches the forearm extensors. Again, you can provide a little bit more pull to increase your stretch. All right. We want to rotate the wrist, keep it around. Mine is popping right now. So that means I haven't been doing my stretches today. This is what we're doing them for. Now, this again is something I do at least several nights a week after a long day of massage, which again, repetitive motion. So all of you who get home from your busy job doing all these motions, pulling, grabbing, lifting, little bit of oil, grab right here at the elbow, and we're just going to squeeze and pull toward the wrist. Just gently right now. We're just warming up the muscle, getting a little circulation. Pull it toward the wrist. You can even pull all the way down to the thumb. Go both sides. Just squeezing gently. Kind of soften up the fascia as well as bring blood to the muscle. All right. You can see I'm moving a little bit of blood. Now you can see as my hand turns red as I go down. And then when I let go, it goes back to normal. That's normal. That just means you're moving circulation. All right. So that was just a light warm up. If you're in inflammation right now, that may be all you can handle. In which case, just do that. Give it some ice afterward, rest it as much as you can, and then wait for when the inflammation has gone down to go into what I'm going to show you next. Now, this is definitely what I do. I either use my forearm right here, not the pointy part of the elbow, just the forearm. I also have this tool. This is a lomi stick, or also called a bamboo massage stick. These are cheap enough to purchase on Amazon. I believe I spent all of $12 with shipping. You can either use this if you have a small marble rolling pin, or you have a basalt river rock stone like we use for hot stone therapy. Any of those can be really good tools. Now, when you're using a tool rather than your arm, you need to make sure that you're careful not to injure yourself. So let me show you with and without the tool, all right? So I'm going to rest my arm across my lap, and I'm just going to lean, start at the elbow, and just gently glide down to my wrist. Now this is where you're going to apply whatever pressure feels tolerable to you. If it's making you make the tequila ooh ee ooh face, that's too much. If it's causing nerve twinges, that's too much. Then lighten your pressure. However, if that's just not doing it for you and you're really super tight, take your little tool. Now I've got it in my hand thusly. You can either do these, roll it. This is the more gentler, superficial, kind of get into the fascia a little, or use the tool like I was using my elbow and just push gently, and watch how slow. Okay, we're not in a race to release the muscle. We're gently working with it and sculpting it back into place using just the pressure. Oops, see, did you hit that little thunk? That was two muscles in my forearm that were stuck together that just separated. So you're going to get that. You're going to get little thumps and little squeaks and your wrists may pop. This is all normal. Oh, see, there was another one. So that's called an adhesion. That's when two muscles or muscles and connective tissue are stuck together. A lot of that is posture and repetitive use because those muscles work together alongside one another, and then they kind of just form a cohesion. All right, so you'll want to do both sides. Now this is tennis elbow, starts here and goes to here with a pain. This is golfer's elbow. The movements are going in this way for golfer's elbow. Okay, again, you can use your little tool, just going, because you really, whether you're having pain on one side or the other, you really need to work both sides of the forearm. The only way to make sure that you're balancing both sides of the forearm is to work on them. Okay? Now, carpal tunnel syndrome is created when you spend a lot of time grasping, maybe wrenching, holding tools, pulling with your hand closed. That shortens the carpal tunnel. The carpal tunnel is this little space here between two bones in the wrist. There's a flap called the retinaculum that holds down two nerves and several ligaments that come through. And that basically holds it all in place for all the muscles that allow you to do these actions I'm doing right now. So what you want to do is focus on opening this, all right? So take your thumb or your pinch with your fingers. I like to do it this way. It hurts my thumb less. But I'm pinching. See, I'm holding like this. Pinch right there when you feel that divot, and then squeeze toward the pad of your thumb, just pulling gently to open up the palm, pulling gently. Also, you can reach in between the webbing of the thumb, also pinching and pulling As always, we're not forcing the tissue. We're just sinking in and allowing it to release and just going with that. Slow and steady. All right? You want to roll your wrists out. Roll them out. I don't know if you can hear mine popping, but you're going to get some of that because you've loosened everything up. Things are going to be shifting back into place. Open up your hands, stretch your palms. You're going to feel some stretch on the forearms doing this. Coming up, you'll feel a different stretch. You can do some of these, forcing your hands flat. You will get more stretch in the forearm. So, after you do this, I always recommend following up with your choice of CBD creams, BioFreeze, Tiger Balm, whatever you usually use for a muscle rub for pain, and then ice it. Now, if you are using things with menthol, just bear in mind when you ice it, you may end up getting an extreme icy hot sensation. But do give it a rest whenever possible. Whenever you don't have the ability to ice, but it's hurting, run it under super cold water to kind of give it a little bit of anti-inflammatory shock. Also consult with your physician about what anti-inflammatories might be right for you if you're in a really severe inflammation from repetitive use. We've all been there, those of us who've worked in a lot of jobs with a lot of hard work. And again, I thank you all for continuing to keep things rolling while the rest of us are in